This is Dr. Jamie Kaufman, and this is Dr. Kaufman's Acid Reflux Hour. Today the topic is, what is Pepsin and what can I do about it? How can I get rid of it? Before I begin, I'd like to suggest that you look at the blog. Many of the questions I've received this month are very clearly answered in the blog. And in the search engine, you can put hiatal hernia, you can put acidity of fruit. You can put any kind of number of things, and pretty much all of them, most of them will come up. So, and subscribe to the blog, put your email in, and then each week, usually Tuesday morning, you'll get a email with the topic. If you want it, you open it. If you don't want it, you delete it, and the next one will come with the next post. Talking about Pepsin is like a watchmaker talking about how watches work. I became interested in reflux in 1981 after I had several patients with inflammatory disease, and that inflammatory disease was causing big problems. In one case, airway obstruction, and it looked like inflammatory disease. There was inflammation-looking stuff, the redness, the swelling, and so on. So I began to examine the literature that was available, and there was not a great deal of clinical literature, and there really wasn't very much scientific literature. Pepsin is a very powerful proteolytic enzyme. That means it digests protein, it breaks down protein. And so it's the number one enzyme in the stomach is pepsin. And it's used for a lot of different things. For example, scientists use pig pepsin to break down big proteins into little proteins so they can be studied. It's called pepsinization. But before I begin talking about pepsin specifically, I'd like to make a distinction between symptoms that are caused by acid and symptoms that are caused by pepsin. So if you wake up in the morning with a sour taste, it's probably acid. If you have laryngospasm or shortness of breath problems, it's probably related to acid. And so the sort of immediate symptoms, heartburn, is related to acid. But inflammation caused problems. For example, narrowing of the airway, difficulty breathing, even tumors, both benign and malignant. Hoarseness, you're a professional singer doing 8 shows a week on Broadway, and your vocal cords are very swollen, your voice is bad. So inflammation is swelling, and within the tissue there is a war going on between those cells that are trying to clean up the mess inflammation causes, the broken down cells and so on, and pepsin. So pepsin comes up when you have reflux, as does acid. The two things are just the two main things in the stomach. And the acid is what we mostly talk about because it's easy to measure acid. We have had pH measuring devices for a very long time. Pepsin is very difficult to measure. I spent the better part of 15 years developing a Pepsin assay that was taken over unwillingly by me, by someone else. But it's not a very good test. It's a good research test. So sending your spit or something off to be tested for pepsin is not a useful test. Now, if you had someone who could take a biopsy when you had your polyps removed and look under the microscope with special stain for pepsin, so that test doesn't exist either. So the way we look for pepsin is basically based on clinical criteria. So we can say when we see swollen vocal cords, the chances of finding pepsin in those vocal cords based upon the clinical and scientific data, because we've done it, is there's always going to be pepsin there. Where there's inflammation from reflux, there's pepsin. And the pepsin goes on the surface and then gets its way working into the tissue. So pepsin causes damage. It causes a tremendous amount of inflammation. We've seen airway obstruction from granulomas, but the big one is we've seen pepsin, and we believe there's a very strong case to be made for pepsin as the cause of esophageal, lung, and throat cancers. Not the only cause, but a major one. And for example, I've seen many non-smokers with lung cancer. So pepsin is a very large molecule. If I was, let's just say, a water molecule, my neighborhood would be a pepsin molecule. So it's a very large molecule, and it's able to, it's a very, very powerful destructive molecule. So what happens when you have a reflux episode? Up comes the pepsin and the acid. We talk about the pepsin as being like lobsters and the acid as being like seawater. So the lobsters basically connect on to whatever, your throat, your vocal cords, your sinuses. And then, here's the trick. Pepsin requires acid for activation. We ought to really call reflux laryngitis peptic laryngitis, not acid reflux, because it's peptic reflux. Because pepsin is producing most of the symptoms and most of the inflammation. The thing is that if it's in the tissue, let's just say it's in your throat, and you go and you have a reflux study and it's normal, that doesn't mean a thing, because it's activated by any kind of acid. Let's say a Coca-Cola at pH, same as stomach acid. So if you drink things that are acidic, you'll activate your pepsin as much as if you had another reflux episode. Of course, most people with reflux today have, it's snore, S-N-O-R-R, supine, lying down, nocturnal, nighttime, respiratory reflux. And respiratory reflux means that you don't have heartburn, you don't have indigestion by and large, you have too much throat mucus, chronic throat clearing, a sense of a lump in the throat, facial pressure, sinus symptoms, nasal symptoms, voice problems, shortness of breath, asthma-like symptoms, lung problems, and breathing in general problems, respiratory reflux. By the way, respiratory reflux, if I haven't made it clear, is a new term, a replacement term, in my opinion, for laryngopharyngeal reflux. LPR I came up with in the 80s. It means reflux in the larynx and pharynx, but respiratory reflux is easier to pronounce, and it's a bigger term. Now, when you talk about pepsin and you talk about acid is gone pretty quickly. So acid gets neutralized. It doesn't sit around for long periods of time. In fact, when you swallow, you have a lot of bicarbonate in your saliva, you have in your mouth, you have a lot of bicarb around the parotid glands and the other glands that are involved in the air digestive tract make bicarbonate. And so the acid doesn't stay around a long time. But the pepsin, remember the lobsters hanging on with their claws to tissue. So people ask me all the time, how do I know if I have pepsin in my throat? And the answer is, if you have inflammatory disease caused by reflux, you have pepsin in your throat. We've done the studies. In fact, we can't do them all the time, where we actually took people who are undergoing laryngeal procedures, and they agreed. We had a special protocol to take tiny biopsies from the back of the larynx and then look under the microscope after staining for pepsin, and we found 100% of the patients who had reflux laryngitis clinically had pepsin. We also, by the way, found 100% of pepsin in the tissue in people who had laryngeal cancer, vocal cord cancer, whether or not they were smoker or not. So we know that pepsin is the thing. And that work was done more than a decade ago. If you're really interested in this, you can go on to the blog, jamiekaufman.com, read my bio, and at the end of my bio, you'll find my curriculum vitae. And if you look at the work with Nikki Johnston, you'll see that we've done a tremendous amount of work with pepsin. What's really interesting is this work has gone unnoticed. Part of the reason is because it's basic science work, and by and large, ENT doctors, we published in ENT literature, they don't read basic science articles by and large. And gastroenterologists and other specialists, they generally don't read otolaryngology literature. So there are some really beautiful basic science, probably the best basic science that's been done in the 2000s, 2010, and now carried on by Nikki Johnston, who's at the University in Milwaukee, Wisconsin, Milwaukee. She's doing beautiful work, and she's the one who's trying to come up with this anti-pepsin drug. Now, even saying anti-pepsin drug makes me nervous. We think that fosmanprevir in a spray can prevent pepsin from binding and will help respiratory reflux people, particularly, for example, the Broadway singer, those kind of people. But it's not a cure to disease. And I've had a lot of questions today about different types of treatments. And the answer to the question is, reflux is not a medical problem. It's about diet and lifestyle. So if you want to get rid of your pepsin, you've got to live clean enough so you have no reflux at all for a period of at least a month, so that you wash out pepsin. Now, I do want to talk about some specifics as I go along. One of the things we see is a lot of people have the upper valve not working. It causes sensation of a lump in the throat, difficulty swallowing, and plus it's not working if you have respiratory reflux or reflux up here into the respiratory system. And alkaline water we highly recommend at pH 9. I recommend you get one without a phosphate. The most popular one now made by Coca-Cola that's everywhere has phosphates in it, and people complain of it burning their throat in some cases. But if you look on my last post on alkaline water, you'll see these little bottles, and this turns out to be a very important therapeutic adjunct. When you swallow, your lower throat clamps tight as your fist to prevent aspiration from water going down the wrong pipe. However, if you put your alkaline water that's pH 9.5 or 10 here, I can spray my throat, I can spray my vocal cords, I can actually wash out pepsin. Pepsin dies at pH 8. This is 9.5. If you have nasal problems, when you go on my blog and click on this same company makes nose drops. If you have nasal symptoms. Very interesting observation. So you get up in the morning, and before you get out of bed, you put the alkaline water on both sides of your nose. It's almost a diagnostic test. If it burns, who knows why? You have terrible reflux. The burning will stop when the reflux is under control. You got a lot of pepsin, whatever, who knows? I don't know the answer to why it burns in the nose. But this turns out to be very valuable and very useful, particularly for people who use their voices professionally, and that turns out to be most of us. Now, so the question comes up again and again and again, how do you get rid of pepsin? How do you get rid of pepsin? How do you get rid of pepsin? So let me answer the question by saying, even the drugs that we're going to come up with, fosmanprevir, even if we had a drug, there are drugs, we could make the pepsin stop, but there would be a lot of side effects. So we don't think there's going to be a pill to make pepsin go away. We don't think there's a pill to make acid go away. So the answer to the question is, based upon clinical experience and examination, for example, when I do an examination, I do what's called a reflux finding score. So normal, no findings would be 0, and in Jamie land, a 15 is an F. So you can say, well, how could I judge how much Pepsin and how is it washed out? Well, the answer is I've seen people, not often, go from a 15 or 16 a reflux finding score to a normal examination in a period of weeks, maybe not 3 weeks. And so the answer is, in my belief, that the Pepsin can be washed out in a period of time, but the washout means there are no further reflux events. So that gets back to this whole concept of a detox. We're talking about no eating within 7 hours of bed, a reverse intermittent fast, 45 degrees, Gaviscon, Advance, famotidine, particularly the double dose 40 milligrams at night, alkaline water spray, and gum chewing. And I've talked about these. And by the way, for those of you who are asking questions which I'm not responding to today, particularly about specific drugs, and there are several articles on there's two on supplements. The most recent is called The Good, the Bad, and the Ugly. The good help, the bad don't do anything, and the ugly make it worse. And I can tell you HCl makes it worse. Why would you take any kind of acid if you have Pepsin causing most of the tissue damage and inflammation and even carcinogenesis? So there's no answer to the question how fast can it be washed out, but I think the sine qua non is that you get reflux under complete control for long enough to let things heal. What heals? Well, the lower valve heals, and that's important. The esophagus heals, and that's important. The upper valve heals, that's important. And the inflamed tissue itself can heal. And as with most things, I think, and why we recommend a month detox is that a lot of things heal in a month. You cut yourself, it's healed in a month. You twist your ankles, probably okay in a month. And so most things, if left in a healing posture, meaning you're not going to keep injuring it, will heal in a month in most people, unless you're immunocompromised or have something else going on. So the question of how to get rid of Pepsin becomes then, how do you stop reflux completely? And it will wash out over a period of weeks. Plus, the alkaline water spray is useful. Alkaline water is particularly useful. For people who have Barrett's, you should be on alkaline water for life. You should sleep on an incline for life. You should eat early for life. And if you go on my post, there is an article on Barrett's, and I'm planning on writing another one soon. It covers more material. It'll be in the next couple of weeks. So, how to get rid of Pepsin? Start by reading. And by the way, for those of you who haven't read much of my stuff, almost all of the articles that have been written this year cover material that relates to most people. The biggest one being SNOR, S-N-O-R-R, silent nocturnal respiratory reflux. It is what you have. You may not know it, your doctor may not know it, but that's where you get sinus problems. Please don't have surgery. That's why you have asthma, but maybe you or your doctor don't know that it's reflux that's the underlying cause. So silent nocturnal respiratory reflux is the game that we're in, and 100 million people have it, and most of them don't know it, and most of the doctors don't know it. Now, so the question is, what do you do? And I suggest you start with the detox. I think that article was written in January. And if you just go on the blog, jamiekaufman.com, and type in reflux detox, it'll come up. They'll discuss the diet and lifestyle changes as well as the diet itself. And the diet itself is low acid, low fat. During detox, only fruits, melons, and bananas. There's no fatty meats. There is some poultry and fish allowed, but otherwise it's a predominantly vegetarian, grain-based diet. And nobody should lose weight on it. Nobody should starve to death, and I am that. And matter of fact, there's another blog called Chegan, and I made up the word. It's called Cheating Vegan. So I was a vegan for a long time, and I was having some trouble getting enough protein. Most of you need about 2,000 calories a day and about 45 grams of protein. And so I was rummaging around in my cupboard, and broccoli has, I think, like 3 grams of protein per cup. So I was rummaging around, and I looked at my can of sardines and olive oil, and it had 26 grams of protein. And that's when I reintroduced fish. Even if you don't Like sardines, I think that wild-caught salmon is just wonderful, and that's my personal preference. Now, I'd like to address some of these questions in relationship to what I've said about Pepsin. The first is, no, you can't drink soda pop. So if you love Diet Pepsi and you have reflux, don't even bother to see a doctor because they can't help you. Reflux, only cure. I wrote an article recently about can surgery cure my reflux? And the answer is no. I had a guy who was very angry at me, Wall Streeter, went to have the surgery, and like a month later he was refluxing like a bandit. He goes out to Keen's Steakhouse in New York, and he goes late, and he has 2 cocktails, and then he has a ribeye steak with all the sauces and all the fancy stuff and all the wine. And so, it doesn't matter whether you've had inflammation from a little valve or now you have inflammation on a big rebuild valve, but it becomes stiff and swollen. And it doesn't mean the surgery's failed, it just means that the amount of inflammation that has been allowed to gain traction over time means the new valve doesn't work. So the answer is there is no pill or procedure. So people ask me about these things like they're going to make a difference. So I will talk about some of them. Turns out gum chewing is really very important. It came as a surprise, but patients said, when I chew gum, my heartburn goes away. I don't see many heartburn people anymore, but that's what they said. So we looked at it, and indeed, when you chew gum, you make more saliva, more salivary bicarbonate, and you swallow a lot more. So if you chew gum or suck on a hard candy after meals, after every time you eat, it can really help after meal reflux, which is the biggie. We put these Ricolas in the Carnegie Hall. When you go to Carnegie Hall, there are these vats, and you can take free Ricola. And the free Ricolas made a big difference because all those people went out to eat, all those people had a glass of wine, all those people want to clear their throat and cough. And so they suck on a Ricola, and the bell you hear is the jumping cat. And that would help a lot. So that's part of the program. The kind of gum that I recommend personally is I went through the Juji fruit and the bubble gums and the usual. No mint. Mint lowers the lower esophageal sphincter pressure. I personally decided on sugarless cinnamon, and I did it particularly because it has a little bit of a kick. It doesn't cause reflux, and the flavor lasts longer than the other ones. And even though you don't read every ingredient and everything, these are the original Ricolas, the big square ones, and you do suck on them. You try biting them very often, you'll break teeth. So we recommend those, and that's my personal preference. Can betaine, HCl help with acid reflux? The answer is no, but it can certainly make it worse. In that list of things that you can take, the good, the bad, and the ugly, all HCl and HCl-related products are essentially ugly. Question about can you recommend a brand of toothpaste? This question's come up over and over the years, and to my knowledge, with the exception of a very few patients, it really doesn't matter. There's not enough mint that you're getting in. It's not like you're swallowing mints or having a chocolate mint after you're leaving the steakhouse. So we don't think that the amount of mint that may or may not be. I will tell you that I use Arm & Hammer, and Arm & Hammer used to make a bicarbonate toothpaste, interesting, which I cannot find any longer. There are a lot of questions about medicine, so I want to address those. Is Cytotec an effective treatment for reflux? No. And what about, where is it? Voquenza. Okay, so we're talking here about potassium competitive acid blockers and not PPIs. There's not enough evidence to recommend them as being any better. The side effect profile may be worse. You can take 50 Prilosec a day, and instead of making a ton of acids, you'll make a half a ton of acid. None of these medicines give you complete suppression. And the answer to the question, what percent of people are cured, the reflux cured by proton pump inhibitors alone, like Prilosec? The answer is 0. You may improve symptoms, but that's it. So, no, and all of these new things, so we're not recommending an esophageal guard. I don't have enough data. Just so you should know, whenever someone asks me a question, the first thing I do is I go to PubMed. So if something's really good, someone's done a study, and you won't see you'll see the chemical name instead of the trade name, and you can just put it in, and then you can put it in the effect on reflux, acid reflux, GERD, respiratory reflux. You can look at all these different things, and so nothing has come up. The only one that we know works and seems to be the least expensive is Gaviscon Advance. Funny, I wrote an article about Gaviscon Advance a couple of months ago, and it's like sold out, like they ran out of seaweed. I'm sorry, but you can find Gaviscon Advance aniseed. You may have to buy smaller bottles for a while, and 250 mil bottles makes 300 mil. It's not a 500 mil, but it's the best product. A lot of people are using Reflux Raft, and others are using Reflux Gourmet, and I don't have enough data or information. And I'm just talking about now, in this case, not just in the literature, but also clinically. So in other words, I listen to my patients say, oh, I got much better when I stopped taking Gaviscon and I started taking X. Okay, that's not happened yet. It may. Someone may tell me that another product is better. But we've studied Gaviscon Advance, and we like it. And don't worry about minor other ingredients. We don't seem to have any problems with them. This question has beleaguered me for a long time. Do CPAPs make respiratory reflux worse? So let me begin by saying, if you look at the arc of fast food sales in the United States, you look at the arc of snoring and sleep apnea, they're the same. And so it takes, in my opinion, 2 decades of supine nocturnal respiratory reflux for a woman to start snoring and get sleep apnea. And if you examine people, read my article on sleep apnea, and you'll see that you can look at the throat and say, oh, that's a sleep apnea person. So, in my opinion, most sleep apnea and most snoring is related to reflux. So, they all get put on CPAP. More important would be eating really early, having a clean diet, sleeping on an incline, get the bed that goes up and down, sleep in your recliner, lazy boys or us. So you need to begin looking at the big picture with all the known variables. There's a reason why your doctor wants you to have an endosinge or a lynx or some other form of surgery. That's how the system makes money. The United States healthcare system is the worst in the world. We think like innovation is good. No, innovation is how a venture capital group makes billions. And then it turns out, oh, that lynx isn't such a good idea. Oh, endosinge doesn't work at all. Oh, and you start looking at all of these different, let's just say, technologies for treatment of reflux, and the answer is, in a word, rubbish. But somebody got rich. And if you don't like to hear that, that's fine. Go have one of those procedures done. But I began using some of these procedures early on. For example, we used Strata for a number of years, and found out in the end that it's not the procedure that counts, but it's the long-term diet and lifestyle. And so that's what I have to say about that. And now, you recommend eating citrus, not eating citrus. How do you get vitamin C? Vitamin C capsules are okay, but don't mix up a drink and drink it as part of a slurry of some kind of vitamins. That's too acidic. But if you want to take vitamin C, you can take vitamin C. Once it's in your stomach, it's not going to have any significant impact on your reflux. Please explain why I'm always coughing up thick phlegm. Respiratory reflux. The term respiratory reflux works in a couple of ways, because the lining of the respiratory system are mucous membranes. Mucous membranes make mucus. And when irritated, they make more mucus. Not only that, they make a mucus that's generally thick and white. It looks like almost glue all when you do the examination. And it gets on vocal cords. And when you get it on there, you have to get it off. Especially, you've seen these people on. I saw the president with a bunch of phlegm on his throat, and I wrote a letter saying, "I think you have respiratory reflux." But the phlegm, the lining membranes are all mucous membranes. Thick phlegm is caused by reflux. Period. It can be made worse by drying agents, dehydration, medicines that cause dryness, Sjogren syndrome. I mean, there are things that will make it worse, but thick mucus, throat mucus, vocal cord mucus is pretty much a reflux symptom. And as a matter of fact, it's the number one symptom. You got reflux. I'll tell you a funny story, as a matter of fact. A patient came in to me talking about postnasal drip and reflux. About a 40-year-old guy, Wall Streeter, very smart guy. And I examined him. I said, "You have snoring and sleep apnea." He had terrible symptoms, and he was only aware of the throat clearing and the thick mucus. So it's let's just say it's the bellwether symptom for respiratory reflux. I often have a tickle in my throat that makes me cough. What causes this tickle? One small cough and throat clearing usually resolves it, but it happens so frequently. So cough is complicated. I've taken a lot of time to write about both reflux-related cough and neurogenic cough. Reflux-caused cough produces mucus. It's wet. When you lie down after meals, bending over with exercise. Whereas neurogenic cough is a dry cough. It's always dry. It occurs with laughing, chuckling, going into air conditioning. A diesel truck just went by. So if you look at the book, The Chronic Cough Enigma, it's the only book or the only material that I know that covers this. Plus, it's covered in the blog. So it sounds like you've got reflux, but you might have reflux, and you might have a neurogenic cough, or you might have both. So a lot of these are specific questions. Madeline has been on a detox program, including the Gaviscon, the Pepsin, the whole thing. Actually, it's her husband, off all PPIs, and struggling with throat pain. So I want to end by talking a little bit, which tails on to what I just talked about neurogenic cough. The vagus nerve is, I've written a 3-part article on the vagus nerve. To my knowledge, it's the only information on the vagus nerve on the internet. Everything else is make-believe. This is actually based upon science and treatment of, 25,000 people with vagal problems. So it turns out that there are 3 symptoms that I treat that are related to the vagus nerve. And the most common injury is from a virus. That's what happened to me. I have a partially paralyzed left cord. It happened 30-something years ago. I can't sing happy birthday, but I don't have any other symptoms, and I'm not a refluxer, but my vocal cord never came back. The vagus went out and never came back. Burning throat, neurogenic cough, dry cough, okay, and voice use pain. I just did a consultation. By the way, a lot of you who are really stuck, you can do a consultation with me. It's not cheap, but it will help. We know that it helps because we've looked into a follow-up and found that 3/4 of the people that have done consults with me are well, and that's a big number considering many of them had already been all over the country to see doctors. So to answer the question about the vagus and answer the question about these different symptoms is that there is no hard and fast line. But, for example, burning throat is not just after a meal like heartburn. Burning throat is a symptom. It's a big symptom. It's a daytime symptom. They don't wake up in the middle of the night with burning throat. But burning throat is a neurogenic or vagus nerve symptom, and so is voice use pain. Imagine. So I started to tell you, I took a consult from a woman in Romania who is a translator with tremendous voice use pain. did not have reflux at all, which is unusual, just neurogenic pain. And so if you look on the blog, there's actually a post on the treatment of neurogenic disturbances, and it actually gives you a PDF that you can print and bring to your doctor. So I'm over time today. Yeah, you want to get rid of your Pepsin. Yeah, Pepsin is what causes inflammation, swelling, many cases, bad things growing, benign and malignant. And so you want to get rid of it, but the only way to truly get rid of it is to stop your reflux, and the things like the throat sprain and all that help. So I'll see you next month. This is Dr. Kaufman's Reflux Hour. Please, JamieKaufman.com, and many of the things we've talked about today are shown and expanded there.